Did you know that 1 in 2 sexually active people will contract a sexually transmitted disease by age 25? The San Francisco AIDS Foundation and organizations alike provide good services that are geared toward populations who are specifically higher risk for contracting sexually transmitted diseases such as HIV. I'm a public health major, and I gave a 30-minute presentation last May about HIV. And what fascinated me was that there seemed to be specific factors that correlated with having a higher risk of being diagnosed with HIV and having that progress to AIDS and eventually maybe lead to death. So I think it's very important to provide what we call in public health these vulnerable populations prevention, because prevention is very easy if you have the right tools for it. And a lot of people, I also think it's important because a lot of people fall under this category of being a vulnerable population. So in this presentation, we will identify the vulnerable populations and how the San Francisco AIDS Foundation meets those needs of providing that prevention, as well as how you can help the movement to end AIDS. So first, we need to identify these vulnerable populations as well as ask ourselves why this is important to help. So the vulnerable populations seem to be correlated with specific sexual orientation, race, and drug using habits. Let's dive a little bit deeper into this. Homosexual and bisexual males seem to be disproportionately affected by HIV/AIDS as compared to other sexual orientations. African Americans and Hispanics are also disproportionately affected. And from a statistic from HIV.gov's website, in 2018, it said that 69% of all HIV diagnoses in the U.S. were only African Americans and Hispanics. So they consisted of 69% of those diagnoses, and they only consisted 31% of the population. They only made up 31% of the whole U.S. population. Another population that is at a lot higher of a risk is the intravenous drug user population. In a 2020 fact sheet by UNAIDS, they explain that 500,000 people to 970,000 people died from AIDS-related illnesses just last year. But there is a way that we can help these vulnerable populations. What we can do is offer organizations like the San Francisco AIDS Foundation. Basically what they do is they provide preventative services. They do this in a medicinal way and a non-medicinal way. The medicinal way is from preventative pills, and the CDC publication that was last reviewed in 2020 talks about these preventative pills, and they're called PEP and PrEP. Basically, they are for people who plan on or already have had sexual contact with somebody who does have HIV to prevent contraction of it. For the non-medicinal way, they also provide vaccinations as well as testing services and safe sex supplies that are free. They also provide support that are geared toward these vulnerable populations. So they have on their website what is called communities. And basically some examples of these communities or support groups are people over 50, people living with HIV, queer and trans people of color, among many more. Another service they also do offer is syringe exchange programs. So this is geared toward the intravenous drug user population. Basically what they do is provide clean needles for their use so they don't have to share needles and prevent that transmission, because this drug using habit will take place regardless of legality. In the academic journal called Legal Space for Syringe Exchange Programs and Hotspots of Injection Drug Use Related Crimes, they advocate for the effectiveness that is found from the case studies of these syringe exchange programs. So creating more access to education as well as access to care is a trademark of the San Francisco AIDS Foundations and other foundations alike. With this foundation, we can help improve the health of our vulnerable populations and overall America. So we can help them become more educated, whether that is about the virus itself, HIV or hepatitis, or safer sexual practices or safer drug use practices, as well as give them better access to care. So not only do they have all this new knowledge, but they can also have the opportunity to implement it in their lives. So today I introduced you to the vulnerable populations of HIV/AIDS, how the San Francisco AIDS Foundation meets the needs of these vulnerable populations, and now we're going to talk about how you can help. The San Francisco AIDS Foundations offer a lot of ways to get involved. Basically, I have this here. It's the text messaging system, and you can get access to legislation that you can comment on, as well as access to petitions that you can sign for their cause. You can also work at AIDS foundations around Texas. There's locations in Houston, Austin, and San Antonio. I have the links here as well. These are all ways that you can help without making a dent in your wallet, which is great. And consider how we can all make a difference, and together we can make the world a healthier place. Thank you. I will now open up the floor for questions. Yes. Okay, so the question is, will syringe exchange programs encourage intravenous drug use? The answer to that's a common misconception actually, and the answer to that, based off of the case studies that have been done, I believe in Pennsylvania and maybe Seattle and definitely New York, based on that research that's done from those case studies, the answer is no. The intravenous drug use population actually didn't increase, but the HIV diagnosis rate and infection rate did decrease. Are there any more questions? All right, I'll be in the back if anyone has any more questions. Thank you.